So first, the concept is health promotion. So there are few terminologies first that you must know. Number one is health promotion, health education, health communication, counseling, advocacy. So these are the specific terminology. The concept must be clear. Okay. First one is health promotions. This is not a new concept. Perhaps almost all of you know about this terminology, health promotions. So what is health promotions? Health promotions is the process of enabling people to gain control over the determinants of health. Number one. So health promotion is a process that enables people. Enable means help people so that they can be able to comprehend things and they can control. Is it? So it is your duty as a health promoter or as a healthcare provider or as a doctor, you have to enable people so that they can control the determinants of health and improve their health. So right from the beginning, in several classes, discussions are going on about the determinants of health. Can anybody tell me what are the determinants of health? It's a process. Health promotion is a process of enabling people to gain control over the determinants of health. So you must know right now, perhaps you knew in several classes, what are the determinants of health? Anybody else? What are the determinants of health? Health determinants kungulo. Okay. One is definitely heredity, environment, lifestyle, socioeconomic conditions, utilization of health services. These are the determinants of health. So health promotion means it's a process that will enable people to control all the determinants of health. If we as a human being can control the determinants of health, then we will be able to promote health. So that is health promotion. So it's a process. Health promotion is a process that enables people to gain control over the determinants of health. So right now you know what are the determinants, health determinants. Number one is heredity. That is very difficult to control perhaps. Okay. Then environment. We can control the environment. There are different types of environment. Physical environment. Okay. Biological environment. So you have to control this environment. Then lifestyle. You have to control, you have to enable people to gain control over the lifestyles. Then socio-economic conditions, even education, even income. These are also the social determinants. Education, occupation, income, utilization of health services. So these are the determinants of health. So you have to enable people so that they can control all the determinants. If we can control the determinants of health, then we can be able to promote health. That is health promotions. You see, it does not depend upon the individuals. So it moves beyond the focus of individuals, rather these environmental interventions. Okay? Mass and environmental interventions. You have to change the lifestyle of the people as well as you have to change the environment through mediation, through enabling, through advocacy. Then only we can think about the health promotion. So in a gist, what is health promotions? Health promotion is a process of enabling people to gain control over the determinants of health and improve health. Now here, health promotion is concerned with what? Improving health by seeking influence to number one, lifestyles. You have to help people, you have to enable people so that they can change their lifestyle. What is lifestyle? Lifestyle কাকে বলে? What is lifestyle? বলো, ওই যে চুপ করে থাকলে হবে না, বলতে হবে। বলছো তো? Yes, please. Lifestyle means? দেখো, যেগুলো day to day activities. Okay, fine. This is lifestyle. So you have to modify the lifestyles. Which lifestyles? Those which lifestyles is not desirable. Like which lifestyles we have to change? Those which are faulty. Is it so? So you have to control over the lifestyles. Then next one is you have to enable people so that they can be able to change the health services if it is not appropriate, if it is not sufficient, if it is not appropriate to the time of the beneficiaries. So that is health services. You will change it. That is health promotions. Then modify environment. So there are different types of environment: physical environment, biological environments. So you have to enable people so that they can change the environment with the help of the government, with the help of the other sectors, with the help of the NGOs. You have to change the environment. Then health promotions addresses the determinants of health. How? Through health education and through advocacy. In order to do that, you have to take the help of two terminology. One is health education and other is advocacy. Health education means is a process through which you can change the behavior, or rather I can say health behavior of the individuals by changing their knowledge, by changing their attitudes, by changing their skills or developing their skills. That is health education. And next one is advocacy. What is advocacy? Advocacy means pleading for the well-being of the people. Who can plead? A pleader can plead. Who can plead? That means you as a leader, you can plead to whom? To the policy maker. So advocacy for changing the policy which will be favorable for promotion of health. So two things is concerned for changing the determinants of health. One is health education at individual levels, and next one is advocacy for changing the health policy. Next, so first one what I discussed, what is health promotions. Next, what I discussed about determinants which we would like to change for promotion of health. And next, what I discussed, with the help of health education, we change the individual's capacity or we develop individual capacity, and through advocacy we plead for framing the favorable policy or for building healthy policies. Now how health promotion can operate? Health promotions can operate through health education and advocacy. And how health promotion can approach? Number one is again health education and advocacy. When it was started, previously we did not think about the health promotions. We used to use the word health educations. But we thought that health education is not enough. It is one of the component of changing the health behavior of the people. So it is not so easy to change the health behavior of the people, because the behavior of the people, health behavior of people depends upon so many factors. Again, if we want to improve the health, if we want to promote health, we have to control all the determinants of health. Then only it can be possible to promote health. For that reason, in the year 1986 at Ottawa, a conference was held. The first international conference of health promotion was held in Ottawa in the year 1986. It launched a series of actions among international organizations, national governments and local communities to achieve the goal of health for all by 2000 ADs and beyond. So previously there was a conference in 1978 at, perhaps you know, Health for All by 2000 AD, one conference was held in which country primary healthcare approach, where primary healthcare approach was discussed in the year 1978. Anybody? Where health for all was the motto? Previously in Russia, that is USSR, the city of Alma-Ata. In Alma-Ata in the year 1978, there was a conference that we have to achieve health by 2000 AD through primary healthcare approach. Still it is going on. Now we are telling about sustainable development goal by 2030 or 2000 and beyond. That's why it was telling that goal of health for all by the year 2000 and beyond. The basic strategies of health promotions identified in Ottawa Charter were number 1, advocate, number 2, enable, and number 3, mediate. So, how we can promote health? They were decided that there were 3 strategies for achieving the goal of health promotions. Number 1 is advocacy. That means you have to plead the policy maker so that policy maker can frame the policy which will help us to control the determinants. Once there is a law, then only it will be easy for we people to motivate people or to take action on the basis of that. Say for examples, legal age at marriage is now for girls 18 years, for boys 21 years. So once there is a law, that means policy was there, then it will be easy for us to implement. If there were no such policies, it was very difficult to implement. For that reasons, advocacy was required. Who can advocate? You, as a health promoter, can advocate to the policy makers. Who are the policy makers? Mainly the bureaucrats. You are the technocrats. They are the bureaucrats. So you have to go to them and plead them so that they can frame the policy. You have to make these bureaucrats understand, yes, if we frame this policy, then it will be easy for we people to implement in the periphery or the ground level, then only we can be able to promote health. For that reasons, advocacy is required, means to boost the factors which encourage health. Next one is enable. Nextly, we have to help people, enable people to achieve health equity. Whatever may be our health services, outcomes should be the same or fair for all. And third one is mediate through collaborations across all sectors. Since then, the WHO Global Health Promotion Conference has established and developed the global principles and action areas for health promotion. We will discuss right now about the principles of health promotions, but the action areas we will not discuss in details. Now I am telling about the action areas. There are only 5 action areas on the basis of which we can take actions for promoting health of the people. Number 1, it is related to advocacy, that is building healthy public policy. Number 1, we have to build healthy public policy for the sake of the health promotions. Number 2, you have to strengthen community. Number 3, you require supportive environment. If you want to implement anything, you require supportive environment. Next one is reorient health services, and last one is develop personal skills. So these are the 5 action areas of health promotions. Then in the last, what I will discuss about the 10th international conference, that was a virtual conference held in the year 2021 from 13th to 15th December, emphasized upon the realistic interventions for health promotions and approaches to enable communities to flourish. Next, I will discuss about the basic characteristics of health promotion. There are 4 basic characteristics of health promotion. Number 1, again, enabling people to take control over. To take control over means to take control over the determinants of health. These are the determinants: heredity, environment, lifestyle, socioeconomic conditions, then income, occupations, utilization of health services. These are the health determinants you have to gain control over. The determinants. So for that reason you have to enable people, and people will take the responsibility, their own responsibility. Always we tell, our health is in our hand. Amader shastro, amader hate. That responsibility community should bear. You have to prepare the community in such a fashion that is, then only health promotion can be possible. Requiring close cooperation of sectors beyond the health services. Previously we thought, yes, we can develop health, we can improve health with the help of the, এটা কি লাগিয়ে রাখতে হবে? আমার তো অসুবিধা হচ্ছে, ঠিক আছে। We can develop or improve the health of the people with the help of these health sectors only. After that, we thought that no, it is very difficult to achieve health without taking the cooperations or without cooperations among the other sectors like say food, industry, transport, corporations, what not. Okay, we have to take the help of the other sectors. That means if we tell a persons for balanced diet, okay, that means requires food, then only we can achieve health. So again it depends on the agricultural sectors. Combining diverse but complementary methods or approaches. Single methods may not work. So different methods we may have to apply for promoting health. We will discuss the methods one by one later on. Then encouraging effective and concrete public participation and media. Now, principles of health promotion. Principles means what? The things that you should keep in your mind while promoting health. Number 1 is empowerment. Number 2 is participative. Number 3 is holistic. Number 4, equitable. 5th, intersectoral. 6th, sustainable. And last is multi-strategy. So there are 7 basic principles of health promotions that you have to remember. Number 1 is empowerment. What is that? A way of working with the people so that people can take wise decisions. They can take the decisions with sufficient grounds, sufficient reasons, rational decisions, and that decisions will affect health. Okay? So whenever a community will take any decisions, that decisions will be wise because their health will depend upon their decisions. Nextly, participative, where people take an active part in decision making. That means whenever people will take the decisions, they will cooperate, collaborate with other people that take the decisions, then only it will be worthwhile or wise. So it requires participation. And third one is holistic. Approach must be holistic. There are different dimensions of health. Holistic means you have to take into account that each and every dimension has a particular role for improving health, and at the same time, among these dimensions, there must be an interactions. So physical, mental, social, spiritual, these are the dimensions of health. Each dimension has an effective role for health. At the same time, these four dimensions must have an interactions among themselves, because their interactions also influence our health. Next one is equitable, that I already discussed, ensuring fairness of outcomes for service users. Whoever may be the service users, outcomes will be same for rich, for poor, whatever may be the economic conditions of the people, social conditions of the people, the outcomes must be fair and the same. That is called equitable. Next one is intersectoral coordinations. Working, whenever you are thinking about the promotion of health, you are going to promote the health of the people, you have to take the help of other partners. Suppose you are working in the government concerns, so for promotion of health, you have to take the help of the other private concerns, other NGOs. In collaborations, you have to work. Then only it is possible, or it will be easy to promote health. And next one is sustainable. Whatever actions you will take, that must be sustainable in the long run. Okay? And last one is multi-strategy. That I told you, one method may not work. So you have to take the help of different methods in different times according to the suitability of your program, according to the suitability of your policy. Okay, that is all about the concept of health promotions. Now, I will discuss about different methods. Now it is clear. I will give you 2 or 3 or rather 5 minutes to discuss about the concept of health promotions. Then I will start control over the determinants of health and improve health. That is health promotions. Once again, I am telling, health promotion is the process of enabling people to gain control over the determinants of health and improve health. It goes beyond the focus of individual rather than environmental intervention, social interventions. Okay. Then about the principles. What are the principles of health promotions? How many principles are there? There are 7 principles of health promotions. First one is, am I to write or can you be able to tell? First health promotion, principles of health promotion is empowerment. Number 1 is, write down. Principles of health promotions. Empowerment. First one is empowerment. Means enabling people to take rational decisions. First they will think and take the decision. That is called empowerment. So we have to enable people. Number 1 is empowerment. Next one is participative. Write down. Number 2 is participative. Number 3rd one is holistic. Dimensions of health are there. So each and every dimension has a specific role in health. At the same time, the interactions of the different dimensions also influence our health. And next one is equitable. Whatever may be the outcome must be ensuring equitable outcome for the service user. That is equitable. And next one is intersectoral coordination. Intersectoral, you have to think that it is very difficult to achieve health by the efforts of Department of Health and Family Welfare. Is it health sectors? So it requires the cooperations and coordinations of other sectors also. At the same time, we have to take the help of other organizations rather international organizations, rather NGOs, that is intersectoral. And next one is sustainable. Whatever actions you will take, the effect will be in the long run also. It is sustainable, not for one time. It is sustainable. Action will be prevailing. Okay. And last one is multi-strategy. If one strategy fails, that means in diarrhea we also plan A, plan B. If plan A fails, then we start think about plan B. Here also in case of health promotions, that is multi-strategy. That is the principles of health promotions. Then what I told you about the action areas of health promotions. Action areas. How we can take actions. If you want to take actions, then the basic things are: number one, build healthy public policy. That means if you want to promote health, you have to take actions, and if you want to take actions, you have to build healthy public health policy. Now, say for example, smoking is prohibited in the public premises. There is policy is there. Health policy is there. Again, use helmets. The policy is there. So, first one is build healthy policy. And second one is strengthen community action. You have to empower the community so that community will take actions for improving their health, for promotion of their health. That is called strengthening community action. And third one is, if you want to implement anything, it requires the support of environment. So third one is create supportive environment. If you want to do anything, if you want to achieve anything, if you take any actions in the community as a whole, if you do not get supportive environment, say for example, you have gone to organize a camp, okay? To organize a camp, medical camp, say for example, medical camp. So you require support. What type of support? Logistic support. You can give money to them, but you require a hall, you require a room, you require infrastructures, then other cooperations you require, that is supportive environment. Fourth one is develop personal skills. So these are the action areas, principles and action areas. And last, I will discuss about how to implement all these things with different methods, materials and media. So what is methods? Methods of health promotion and education are the techniques or ways of organizing or taking series of or carrying out series of activities. What for? To inform, to communicate ideas and to develop necessary attitude and skills for changing unhealthy or undesirable behavior. So these are the methods. Methods means techniques or ways of carrying out different types of activities. What for? To convey the ideas, to inform the people and to change their skills, to develop their skills, to change their attitudes, to develop their skills so that you can be able to change the unhealthy or undesirable behavior. This is called the methods. This is the methods. There are different types of methods of health promotion and education through which you can be able to change unhealthy behavior and promote health. So we can classify these methods into three ways. One is individuals, next one is group, and third one is mass. So individual methods means person to person or face to face communications, which provides maximum opportunity for two-way flow of communications, to a flow of ideas, to a flow of knowledge and information. The best examples are interview and counseling. So these are not common words, these are not new words, these are very common words. One is interview, another is counseling. These are the individual methods. So what is the difference between interview and counseling? Can anybody tell? These are the individual methods. Means we are trying to change the behavior of the individuals or a family members, a family which are unhealthy as far as the health is concerned. So what is interview and what is it? Rather you can say the difference. Can you be able to tell the difference between interview and counseling? Interview তে আমরা কি করি? Perhaps you have faced the interview? Viva face করেছো? Anybody? Did you face Viva? Did you face any interview? Interview face করনি? Nobody face any interview. Interview means asking questions. What for? For gathering informations. That is interviewing. And in case of counselings, we can gather questions, gather informations through different types of questions. And again, once we know the problem, we will try to solve the problem of the client with the help of the response of the client. That is counseling. Counseling, that is the difference. In case of interview, we only gather the informations, and in case of counselings, we gather informations. Then we give options to the client so that he or she can solve his problem by his or her own effort. We try to help him so that he or she can develop his personal resources and solve the problems. That is the difference between interview and counseling. So both are the individual methods. Next one is group methods. What is group method? This method involves a group of limited persons in the teaching learning situations who have some kind of health education needs about health problems. This small group can also get some opportunity to ask questions for clarifications through two-way communications. Examples of this group methods are demonstrations, panel discussions, colloquy, symposium, seminar, role play, etc. And next one is mass methods, applications in large surroundings, okay, large community settings. This method is especially meant for a large number of heterogeneous people. It helps in teaching broad section of populations or large populations at a time. You can aware a large number of people within a limited period of time. Say for example, that is speech, lecture, exhibitions, etc. Clear? So we can divide the methods into three, or rather we can say we can approach. There are three approaches. One is individual approach, another is group approach, and third one is mass approach. But the question comes, in what situations we would like to adopt individual approaches? In case of complicated cases, individual cases, family problem, okay, we can take the help of these methods. This is individual methods like counseling or interview. Rather, I can prefer the method that is counseling. Then next one is group methods, when we think that yes, we can discuss this problem in a small group and we can able to solve the problems. That is group methods. And when you think that yes, the problem is there, the problem is concerned for the mass, so we can avoid the people at a time. Large number of people will gather and we can help them to become aware about a problem. Then we can take the help of mass methods, that is mainly speech, exhibitions. Now, on the basis of the feedback, we can classify the methods into two. One is one way, that is didactic. Best example is lecture. And another is two-way, that is didactic. Best lecture is demonstrations, panel discussions, seminar, symposium, colloquy. Okay. So one way, two-way, and there is on the basis of the approach, individual, group and mass. Now, next slide, I will try to show you individual, group and mass. Individual methods, interview and counseling. Group methods, demonstrations, panel discussions, colloquy, role playing, symposium, group discussion, brainstorming, batch sessions, workshop, seminar, study team, etc. And last one is mass methods, that is lecture or speech, exhibitions, health campaign, etc. Now question comes, lecture and speech. In classroom situations, we use this terminology lecture, but in community situations, we use this terminology speech. Okay, this is the classification of methods. Now, I will try to discuss almost all the methods one by one. First one is lecture or speech. What I am delivering, what is this? What is this? Lecture. So it is one way. Until and unless I convert it into a forum, you do not get the opportunity to ask me for your clarifications. So it is one way. Lecture is one way. What is lecture? It is oral presentations. I have carefully prepared. It is carefully prepared oral presentations by an expert to the audience in a concern or a specific topic by using simple, lucid word so that audience can understand. That is lecture. What is lecture? It is a carefully prepared oral presentations by an expert concerning a specific topics using a lucid, simple words or language so that audience can understand. That is lecture. Okay. But next question is, when it should be used? When we think that the audience are not aware about an issue, or if at all they are aware about the issue, they do not have a minimum knowledge, on the basis of that they can interact. You cannot interact with the speaker, so in that case we use lecture or speech as a method of education. And next one, if our objective is to help the audience to gain knowledge, not skill. And last one, though this is not appropriate right now, okay? Always lecture should be organized in the forenoon, okay? Not in the afternoon, because in the forenoon you are fresh, okay? You will not become sleepy. After lunch, you will become sleepy. You means the audience. For that reasons, lecture should be organized. This is not lecture as such right now. Okay. So, lecture should be organized in the forenoon, then it will be more and more effective. In the afternoon, always we have to engage the learners, like role playing, like small group discussions. Now, in lecture, how many personnel are involved? Usually, 3 type of personnel are involved. One is chairpersons. So, as you see, I am the intramural. For the reasons, there is no need of chairpersons. Next is a speaker or the lecturer, and third one is audience. What should be the characteristics? You will act as a lecturer. then you will act as a chairperson. Okay. So you must know about the characteristics of the chairperson. Chairperson means must be a knowledgeable person, skillful person, so that he or she can manage the situations. He or she should have the vivid knowledge, enough knowledge about these topics which is going to be discussed or which is discussed by the speakers. Next one is speaker or the lecturer. Again, he should have the minimum knowledge so that he can deliver his speech or lecture to the audience without fumbling, rather with the help of the confidence, with confidence he can discuss the things, okay, by using lucid, simple, interesting language. He will be able to create interest among the learners. And third one is audience. Audience means the persons who have little bit interest about the subject concerned which will be discussing or which the speaker is discussing. Then only you will listen. Pattern of communications in case of lecture, I told you we can classify the methods according to the feedback to one way, that is didactic, or two way, that is Socratic. So this is lecture is one way, is it? This is one way. Okay. Communication will be from dash to the floor. Now, in each methods, in each and every methods, there are some advantages as well as some disadvantages. From the examination point of view, if any methods comes, okay, usually in this format, say panel discussions, short notes, panel discussions or speech with advantage and disadvantage. For that reasons, you should know about the advantage and disadvantage of each and every methods. What are the advantages of this speech? One speaker can teach a good number of learners for enhancing knowledge. I am using audiovisual aids, but as such in a lecture, audiovisual aids is not compulsory. It is not that much expensive. Message can be systematically disseminated. Disadvantage, may not fulfill the needs of the learners if he is not interested to know the needs of the learner. So, the needs of the learners may not be fulfilled. Number two, learners are passive listeners. Next, group methods. Panel discussions. Panel discussions. What is that? It is an educational methods where a small group of usually 4 to 8 persons get around the table and discuss among themselves a topics concerning to them, and the topics will be required to discuss in the front of the audience, in which the panelists and panel members have specialized knowledge. Then 3 or 4 characteristics panel discussion. Number 1, 4 to 8 persons get around the table and they will discuss among themselves topics which will be interesting to the learners. That is panel discussions. It is to and fro discussions among the panel members like this. In a table, so this is the table. This is the table, I will show you the picture. This is the table. Moderator will be here. 3 or 4 panel members will be there, this side, and this side 3 or 4 panel members will be there, and they will discuss among themselves. You as a learner or the passive listener. Okay. It should be organized when the topics is large, so large. That means if lecture is organized, it is not be possible, it will not be possible to finish, but with the discussions it will be finished. So when the topics is large, complicated and need clarifications from different angles, when a group of experts are available. Now this is the sketch. This is the sketch of panel discussions. If you simply remember the sketch of the panel discussions, then you will be able to comprehend what it is. This is the panel discussions. This is the table, okay. In the middle, there is a moderator. In the one side, how many panelists are there? 4. In the left side, 4 panelists are there, and the right side, other 4 panelists are there, okay. In panel discussions, what happened? This moderator will open the sessions. That means he will say, today the discussions will be about the balanced diet, okay. Then the panel members will discuss among themselves. The right side, 4 panel members are there. Left side, 4 panel members are there. So, one panel members raise questions to other side. Say for example, the right side, one panel members belonging to the right, sitting in the right side, asking questions to the panelist of left sides. So, left side panel members will answer the questions raised by the right side. In this way, left side, right side crisscross. Okay, discussions will be going on unless the objectives of the discussions is finished, definitely within a stipulated time, maybe 40 minutes or 45 minutes or 50 minutes. Usually there is no hard and fast rule of discussion, but usually we tell within 1 hour this panel discussions will be finished. Otherwise, the person concerned who are the passive listeners will be less interested. So, within 45 to 45 minutes, panel discussion will going on. They will discuss among the audience. Third group is audience. Audience will listen when they will discuss. Okay. This audience are the passive listeners. You as a panel, you as a audience, you do not have any opportunity to ask questions. To whom? To the panel members. Until and unless it is converted to forum. So, this method is called panel discussions. This is one way or two way. This panel discussion is one way or two way. He is telling two way. Is it one way or two way? One way. Why it is two way, Baba? Two way means when there is interactions between the dais and the floor. Is there any interaction between dais and the floor? No. They are discussing among themselves. They means the panel members are discussing among themselves. Is it? So that's why it is one way. Otherwise, it would have been two way. Panel discussion is one way. Why it is one way? Why panel discussion is one way? Raise your voice. Raise your voice. Why panel? Please stand up and tell. You stand up and tell why panel discussion is one way. I told you several times. Use the microphone and tell. सामना सामनी बात है किसको? Why it is one way? बोले तो one way. क्यों one way बोलो? जोड़े बोलो सवाई सुनो.
कारण सर टायर से जरा से तारा जिधर मुझे आलोचना तो टायर सब थोड़ी मुझे कोनो कलेक्शन.
उत्तर ठीक আছে? ওয়ান ওয়ে কখন বলা হবে? যখন ডায়াসের মধ্যে আলোচনা হবে, যারা ফ্লোরে থাকবে তাদের কোনো সুযোগ থাকবে না কোশ্চেন করার। when there is no opportunity of the floor to ask questions to the dais, then it is called one way. Is it clear? পরিষ্কার হয়েছে? Otherwise, the other name of one way is didactic and other name of two way is Socratic. Okay. So panel discussion is one way. Though it seems it is two way because the name is panel discussion. Still, panel discussion is a one way because panel members are discussing among themselves without giving any opportunity to the audience to participate or to ask questions. Is it clear? Each and every methods have two advantage. and few disadvantage. What are the advantage? Number one, to present the topic subjects by different experts actively and dramatically. Number two, provides varied knowledge, ideas and experience about the subject of the concern to the audience or learner to get different viewpoints or facts from different experts. These are the advantage, interesting and can draw the attention of the audience or learner. Next, learners can get the opportunity to ask questions and pass comments which help in teaching learning process at the time of panel forum. Usually, I told you that the panel discussions usually last for 1 hour. Is it 40 to 45 minutes for discussions among themselves, and next 5 to 10 minutes or 15 minutes. Usually these panel discussions is converted to panel discussion forum. This panel discussion is converted to panel discussion forum. It becomes two-way. Forum means open discussion. When it will be converted to forum, it is called panel forum or in long panel discussion forum. So panel discussion is one way, panel discussion forum is two way. So what is the disadvantage? See, sometimes it is difficult to get the appropriate experts because we require experts means 3 plus 3 is equal to 6 plus 1 7, 1 moderator and 3 or 4 panelists in each side. So 4 plus 4 8. It is very difficult sometimes. Next one, difficult to set definite time to suit the experts. Third, experts may not understand the needs of the audience. Sometimes it is not possible to convert the panel discussion to panel discussion forum because of lack of time and opportunity. So in that case, this audience will not get the opportunity to ask questions to the experts. So then it is not panel discussion forum. What is panel discussion forum? Tell me. What is panel discussion forum? Panel discussion forum kake bolbe? You are Bengali? No, non-Bengali. Non-Bengali. So what is panel discussion forum? Please tell me. Forum. Audience sir, কি পড়ছো তুমি? তুমি কি পড়ছিলে? What you are studying now? Huh?
Same topic.
Why you are not able to tell? Tell. Panel discussion forum কাকে বলে? What is panel discussion forum? From? When the panel members are discussing among themselves, that is called panel discussion. My question is, what is panel discussion forum? Who can tell? Who can tell what is panel discussion forum? তুমি কি পারবে? তোমাকে বলছি, পারবে না? পারবে না? প্যানেল ডিসকাশন ফোরাম কাকে বলে? 3 দিন পর তো পরীক্ষা, ওই জন্য জিজ্ঞেস করছি। Good, good. Very good. When there is interaction between dais and the floor, that is called forum. So this is panel discussion forum. When these learners or the audience will have the opportunity to ask questions to the panel members. This is called panel discussion forum. Is it clear to everybody? Clear? Okay. Next, colloquy. This is another health promotion methods. Colloquy. There is a similarity, almost same. It is almost same or similar to panel discussions, excepting that in case of panel discussions, the both sides panelists are there. You see the sketch. But in case of colloquy, in one side, resource persons or experts will be there. তুমি কি করছো বাবা? What you are doing, Baba? না ওটা কি? ওটা তুমি কি খুলেছো? দুটো জিনিস খোলা আছে, খাতা খোলা আছে, আর ওইটা কি? ফোন। কেন? তুমি মিলিয়ে দেখছো, আমি বলছি তাতে আমার অসুবিধা নেই, বাট অ্যাটেনশন দাও, পে ইউর অ্যাটেনশন, দ্যাট ইজ মাই রিকোয়েস্ট। ওকে, okay, so the difference is that in one side panel list, or here I should say resource persons are there, in other sides audience representatives are there. That is the difference between panel discussions and colloquy, and this is more and most appropriate. Colloquy is most appropriate in the community setting, because in case of colloquy, audience representatives are there in the dais. As they are from the audience representatives are from the audience. So if the audience representative asks questions, then audience will feel they are our representative, they are our people, okay, onus will be ours. They will get more and more interest, and they will feel free to ask questions through their representatives and listen carefully. So colloquy means it is the modification of the panel discussion. It is useful when the audience are influenced by the opinion leader. Again, there is another terminology. Okay, when I am giving emphasis upon a terminology, mind it. This is very important to know. Another word is opinion leader. Who are the opinion leaders in the community? The question is there that the colloquy will be more and more applicable in the situations when audience are influenced by the opinion leaders. I told you about the advocacy. I told you about the implementations. So advocacy means to plead. Here also, you as a health promoter or the medical officers, you have to approach the opinion leaders. If you think that if I can motivate the opinion leaders, my job is, the task is finished. I will be able to achieve my objective, as the opinion leaders will percolate these things to their followers. And what opinion leaders will tell, followers will follow. So here, this is the questions. When colloquy will be useful? The colloquy will be useful as a method of health promotions in the community settings when the audience are influenced by the opinion leaders, and when there are specific problems to discuss for solutions. This is always two-way. Why it is two-way communications? Always colloquy is two-way. This is the sketch of colloquy. Why it is two-way? Because audience representatives are there. They are from the audience. That's why it is always. Who will start? M here for moderator. Who will be a moderator? You see, in the first or second, first, only first method, when I discuss about the lecture or speech, I uttered the terminology chairpersons. Thereafter, I started to tell about moderator. So there is a difference between chairperson and moderator. Moderator means moderate. Is it? Chairperson means sometimes he can also moderate. But you see, like the difference between formal and informal, here also chairpersons and moderator. In case of panel discussions, moderator was useful because both the sides, the panelists are there. Their status as far as the knowledge is concerned, their skill is concerned, their prestige is concerned, status is concerned, they are more or less same. So when the question is raised in one side, asking answer to the other sides, there may be a controversy. Is it? For that reason, the terminology moderator is useful. He can moderate. Okay? He can resolve the situations. Here also same things. Audience representatives, they are the leaders. They think they are the leaders. Okay? So conversations will be going on in case of colloquy. Only the audience representative will ask questions. That is the again difference between panel discussions and colloquy. In case of panel discussions, either sides from the panelist may ask questions and answer the question vice versa. But in case of colloquy, only the audience representatives will ask questions to the resource persons. Resource persons are not allowed to ask questions to the audience representative. Only the audience representatives will ask questions to the resource persons, and resource persons will answer the questions raised by the audience representative. As the audience representatives are from the audience, once they will finish these questions, but if the objective is not finished, if the audience raise their voice, hand, okay, then with this help of small piece of paper, they can send their questions to the audience representatives, and the audience representatives may ask questions to the resource persons. In this way it is going on. For the reasons, this is always two-way. Okay. Advantage, direct audience representations. That means it will be more and more effective. Audience participations, problem solving methods, no inhibition as representatives are in the dais. So they will feel no inhibitions to ask questions. Very effective for solving the problems by mutual consideration. Disadvantage, skillful moderator may not be available sometimes. Audience representatives may sometimes feel shy to ask questions because they may think, oh, they are the experts, they have the enough knowledge, what things I can ask to them. Next one is symposium. Perhaps this method is not new to anybody else. কে নাম শুনুনি সিম্পোজিয়ামের? প্যানেল ডিসকাশন কলোকির নাম না শুনতে পারো, সিম্পোজিয়ামের নাম শুনেছো? Nobody? Why you are feeling shy? I can't understand. Symposium. In case of symposium, it's a series of lecture by different experts, one by one, concerning a single topics in the presence of chairperson and audience. When a number of experts will deliver their speech one by one concerning a single topics or closely related topics within a stipulated time concerning a single topics, it is called symposium. In symposium, what happens you see? It is opened by the chairpersons. Chairpersons will introduce all the resource persons one by one to the audience, and then the chairpersons will call the resource persons one by one. They will come, they will deliver their speech or presentations. How it will start? The whole topics will be divided into few small portions. Say for example, if the topic is anemia, fine, anemia, its prevention and control, that is the topics. So one person may come about what is anemia. Once he finish, then next person may come how it can be prevented. Third person may tell about what the ways and means of prevention. Next persons come, he can say about how we can control. Likewise, in between, one person go and next person comes. The chairman will call the next persons. In between, one person go and second person comes. If any point is missed by the first persons, usually these chairman supplement these things. Okay? If one person omit a point, the chairperson will supplement. Then call the second person. In this way, it will be going on. That I have shown. I told this one. Advantage, it is very interesting and useful for the learners as they get the opportunity to listen from different experts, from different viewpoints concerning a single topics. Develop the habit of listening and critical thinking. Disadvantage, again it is very difficult to get so many experts concerning a single topics. There may be chance of repetitions of the same thing if the experts are not informed beforehand about the different portions of the topics. Okay, 15 minutes more. কি হাঁপিয়ে গেলে নাকি? আর তো উপায় নেই, আজকে শেষ করতে হবে। Next one is group discussions. It is one way, two way. I will not discuss. I will ask the questions, and if you cannot be able to answer, I will answer the questions. Group discussion itself is one way, two way, two way. Sketch. Can anybody come? One person come and draw the sketch of group discussion. It will be very interesting. Come on, please. Volunteers. Volunteers. Come. You are the experts. Group discussions. Come. Ki aste pare? Nobody. Feeling shy. This is not the examination. Eso ekjon eso. ঠিক আছে? This is the sketch of group discussions. Is it okay? How many persons are involved? Type of persons. One is discussion leader, note taker. Here may be also note taker or rapporteur. फाइव के बोलले बाबा? So, three types of personnel are involved. Is it? One is discussion leader. You can sometimes tell facilitator. Okay. Note taker. Usually two note takers. One can act as a rapporteur. One can act as a note taker. And next are the P for participants. P for participants. Okay. Group discussion means it's an educational method. It's an effective educational method in teaching learning situations where each and every participants, or rather you can say each and every learners, have the equal opportunity to take part, to participate in the discussions and solving the problem, or to know many more things in the mode of discussions. Equal opportunity. Everybody has the equal opportunity. That is the sketch of group discussions. Okay. Usually we call about the small group discussions. Is it? In case of small group discussions, theoretically maximum numbers will be 12, minimum number will be 6, but many a times it is not possible to maintain. But you see, for effective group discussions, there is no hard and fast rule. It varies from 6 to 12. So these are called the participants. Okay. This is the sketch of group discussion. This is the sketch of group discussions. So, here you see, it is valuable educational method because all the participants are given equal chance to express freely and exchange their views and ideas. The subject of discussion is taken up and shared equally by all the members of the group. It is a collective thinking process to solve problems. Problems are identified beforehand, collectively, and the solution is worked out by pooling ideas and expertise. When it should be used? When we think that the participants have the minimum knowledge, on the basis of that they can participate. In case of lecture, just opposite. In case of lecture, when you think that they do not have any knowledge, they cannot participate. But in case of group discussions, when we think that yes, at least little bit knowledge you have, on the basis of this knowledge, you can participate in the discussion. Because you see, objective is to solve the problem or to discuss the problem vividly so that we can draw solutions of the problem. Okay. It should be used when the participants would have minimum knowledge, on the basis of which they can interact among themselves and can be able to carry out the solutions, carry out the discussions to achieve the goals. Personnel involved, discussion leaders, recorder or rapporteur or note taker, 1 or 2, and then group members. Participants will be 6 to 12. There is a lot of difference between FGD and group discussion. Focus group discussions and group discussions. Don't get confused. Okay. Later on, if time permits, I will discuss about the FGD. Okay. FGD and focus, that is called focus group discussion, and this is group discussions. This is group discussion, is a problem solving process, but in case of focus group discussions, we collect qualitative informations. In case of focus group discussion, only we ask questions. In case of focus group discussions, but in case of group discussions, we try to solve the problems with the help of the active participation of the members. What should be the characteristics of the group members? Number 1, the group must be homogeneous. Homogeneous in that sense, age group. Number 1, educational qualifications, cultural background. Okay. In that sense, it must be homogeneous, must have minimum knowledge about the subject or topics to be discussed. Otherwise, they cannot participate. Advantage: members get opportunity to know each other. Number 1, all members, because see the sketch, everybody can see the face of others. Is it so? So, members get opportunity to know each other. Number 2, all of them get an equal chance to participate. It helps the learners to come to a group decision and solve their problems. Help members to become active learners and learn new knowledge, ideas and experience about the subject. Develop creativity and attitude of working together. How we can start a group discussion sessions? Usually, before starting the group discussions, with the help of the exercise book, in practical what I am telling, we jot down the name of the persons, and while jotting down the name of the persons, their age, their educational qualifications, we jot down. At the same time, we give a small sheet of paper, hard paper, okay, where we write number 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Here 10 participants are there. So 1 to 10, 1, 2, 3, 4, 5, 6, 7 and 9, 10. Because it is not possible for the note takers to note down the name of the participants, only we jot down the number. How we can show the number? With the help of the small piece of hard paper, we write the number, and with the help of the safety pin, we paste it. Fine? Okay? Then we start the group discussion. Start. The topics is raised. Before starting the discussions, the discussion leader usually tells the importance of this discussion, the topics. brief the topics, tell the objectives of the discussions, then start the discussion, throwing a question to the group. Okay. Say for example, one question has been thrown by the discussion leader. Then, say for example, person number one catch the question and started to answer. Answer is given by person number 1. Person number 4 is not satisfied or satisfied. Again, he started to give the answers. So 1 to 4. Then 4 to 7. In this way, the discussions will be going on until the first objective is achieved or to reach a consensus. Once consensus has been reached, fine. The next questions. Likewise, it will be going on. Usually, it lasts for again 40 to 45 minutes. Then sum up. Then within 1 hour, group discussion will be finished. Okay. That is all about the group discussions. Okay. Next one is demonstrations. No need to discuss, is it? Everybody knows what is demonstrations. If the questions comes in the examinations, perhaps you will be able to write demonstrations. Demonstration is a process, is a method of teaching where we would like to teach new skills. Teach new skills or techniques. Can you give 1 or 2 examples where this method is more suitable? এমন একটা কিছু বলো টপিকস যেটা ডেমনস্ট্রেশন ইজ মাস্ট, আই শুড নট সে মাস্ট, ইজ ভেরি ইফেক্টিভ। বলো। হ্যাঁ, সিপিআর আর গুড সিপিআর। নেক্সট, হ্যান্ড হাইজিন, হ্যান্ড ওয়াশিং, প্রিপারেশন অফ ওয়ারেস, ওকে, ইউজিং family planning devices. So demonstrations, okay, these are the best. Perhaps you heard the name role play, drama, শুনেছো তো? So it is like a drama but not drama. It is like a drama, it is psychodrama. This is called psychodrama. In case of drama, what happened? Experts are required, expert players are required, but in case of role play, no. Role play means playing the real life situations. Real life situations, that is role play. Okay, that's all about today's discussion.